Welcome everyone to the HidraWear wound care webinar. I'm Suzanne Maloney. I'm the founder of HidraMed Solutions, which is a company making wound care dressings for people with hidradenitis suppurativa. And one thing I've noticed is that wound care is really difficult for people with HS. And I've had HS for over 20 years and always struggled with that. So I thought it would be a nice idea to partner up with some really experienced tissue viability nurses to get a better insight on how we can manage our wounds best at home. So I'm going to introduce you to Kerry and Karen, and they are fabulous wound care nurses, and they also teach other tissue viability and wound care nurses how to manage wounds. So Karen, do you want to say hello?
Hi Suzanne, how are you? Thanks
Hello.
so much for having us.
Do you want to
Kerry and I.
Yeah, tell us a little bit about yourselves and we'll start off.
Both Kerry and I are clinical nurse specialists in wound care within the community setting. We do co-hold clinical caseloads. Also, we do lots of teaching, and I suppose that's where our passion is. We do lots of teaching around wound care, pressure area care, hand hygiene to nurses, doctors, GPs, pharmacists. We have done some collaboration, and we're just delighted to be collaborating with you here today, Suzanne. Thank you.
Great. Thanks so much. So I've developed a list of FAQs that I've come across in the HS community. And then we've also asked some people in the HidraWear HS community to submit questions. So we'll address all of the questions and we'll get started. The first thing is to understand the different types of wounds that you can get with HS. And we hear lots of words bandied around: nodules, abscesses, boils, fistulas and sinuses and lesions. Are you able to kind of differentiate between the different types of HS wounds, and let us know is there a good way to manage the different wounds as they progress?
Okay, so I suppose it's good to start at what exactly is a wound. So it's a break in the continuity of the skin, and we would divide wounds down into acute and chronic time frames. Usually we heal wounds within 6 to 8 weeks, acute wounds, but unfortunately with HS wounds, they turn chronic. Likewise, there is boils, there's abscesses, have one or the other, or you can have both within this condition. A boil is usually a small red tender lump, develops usually under the skin, usually at the follicle of a hair follicle. An abscess then kind of goes further beyond that. And you can have pussy material coming out of it, purulent material. It can be yellow, it can be green, very painful, very red, inflamed around the area. So you can have one or both, or one or the other. You can have several episodes of it during a period of time, and that's where really your diagnosis will come about. From those, then you might develop some sinuses, fistulas. Again, they're typical of the HS community. Sinuses, you know, they're tunneling under the skin, and fistulas are tunneling as well. Usually a fistula will go from one hollow space to another, usually connecting from hair follicles as well. And a lesion then, for all of those, it's a broad term of abnormalities of the tissue. And within the community setting that we would come across, you know, we would be talking about the likes of chronic wounds, acute wounds, leg ulcers, pressure ulcers. They're all types of lesions.
And so how would you best manage, say, something like a boil that is building and you know that it's going to drain, versus an abscess that has burst and is draining now, or fistulas and sinuses that are consistently draining?
So a boil, as I said, it's a warm, hard lump under the skin, and it's not broken. So traditionally, you know, you'll be talking about home remedies probably for that, the likes of hot compresses, cold compresses. They do say usually a hot compress is more efficient than a cold compress. And again, it's a matter of putting that hot compress on it several times a day for up to a couple of times during that week. Abscesses then, it's when it bursts and there's, you know, yellow purulent tissue coming out of it. You have to treat it like a wound, and you have to cover all wounds, because in relation to infection and that. So yes, so that would be the difference in relation to your boils and your abscesses, open wounds, which have to be covered.
Okay. Can you talk, well, first of all, what is exudate or drainage, and like when should we be alarmed as people with HS? When should we seek medical attention?
If your exudate changes according to what you're familiar with, absolutely, it could be a change in what's going on. Exudate can be clear, yellow, and that's normal. It might turn maybe thick, serous, maybe sticky to a point. It might be a result of the amount of protein that's in a wound. That might reflect maybe the inflammatory process, which is, you know, wounds have to go through an inflammatory process. It's just that some wounds, like HS wounds, chronic wounds, get stuck in the inflammatory process. Then it might get yellow, thick, green, odor might add to it, and it just shows that the protein is increased in it, and it might just show that there is more of an infection occurring. So at this stage then you'll have to go back and look at your full holistic assessment when you're looking at wound care. And in relation to that, you know, before you do all this, you look at your holistic assessment, and you make sure before you do this as well that you look at your hand hygiene when you are carrying out any type of wound care, whether it's a hot compress, cold compress, or looking at an open wound and determining how to cover it. Yeah. Because in relation to that, you need warm, you need moist, you do need some type of exudate to formulate a good healing process.
Yeah. So even though like HS is not typically an infection, there is a lot of exudate coming out of these lesions. So when are you saying when it changes color, or if
when
it
it changes
odorous?
For you? And what's a good type of record that you could keep as a client or as a person with HS is good diary keeping. Us as clinicians would always look at record keeping in the holistic assessment. So for you as a person with HS, yes, you should keep your diary. Then it will highlight to you what has changed from last Monday. So yes, the exudate has changed from clear to yellow, it was last Monday, to now it's actually quite sticky. It might be lumpy, jelly-like. Has there something changed? Has the inflammation process, has the redness occurred more around the surrounding skin? Is there some odor? Have you actually looked at that the exudate that you've had to change your dressings more frequently? Is there more pain? So yes, so you could actually do your record keeping via a good diary, a journal.
Yeah, and I've read about this time analogy, and it sounds really interesting. It could be useful, but I think if we changed it to TIMS instead of time, because I know that E in time stands for edges. But do you want to talk about a little bit about the new TIMS analogy?
Yeah, the time analogy has been going around a long time around the world of wound care. So time, T-I-M-E, as you said, we decided that we would change the E to S for surrounding skin. So time is tissue, looking at the wound tissue, looking at the wound bed. Is it pink? Good granulation tissue. Is it red? Good tissue as well. Or is it yellow? Is it green? What we would call sloughy tissue. That's just dead devitalized tissue. It's doing nothing. We really should remove it. So then we have I. So that can be the inflammation process. Is it extended? Have you established that maybe, yes, the exudate has turned that gloopy look effect? Maybe the inflammation process has extended, or it might be infection. Actually, maybe, yes, there is more exudate, there is more odor, and there is more pain. And then we have moisture. And again, that's your exudate level as well. So if it has increased, or if it has decreased, or if it has maybe stayed the same, and looking at the consistency of it. And that's where your good record keeping will come into play for those three. And then the final one then S, so your surrounding skin. So again, that can be damaged by the amount of protein that's in the exudate. It can burn it, it can cause that itching effect, which really does affect anybody that has lots of exudate around a wound. And especially then it goes hand in hand with that inflammation around it. And it can actually burn it. So it's a matter of protecting that surrounding skin. You can protect that surrounding skin with, you know, good barrier creams, good moisturizers. So yes.
Great. Can we talk about the most commonly used types of dressings used by people with HS? And I know it's difficult because you as a tissue viability nurse have access to like a wonderful assortment of dressings, But it turns out that people with HS are the majority of us are managing our wounds by ourselves and just kind of making do with things that we have access to through pharmacies or supermarkets. So it would be good to talk about the different types of dressings that are available to us, and just to look at them really and their properties.
So yes, there's several different types of dressings. So you're looking at a dressing that will conform to the area. You were going to be looking at a dressing that won't cause any damage on removal. You're looking at a dressing that will be comfortable to wear, that won't cause any pain, that will be cost effective, that won't fall off. So again, you know, looking at the areas then of where you can be pushing these dressings, obviously because of the conformity of dressings, they just might not stay. They'll be bulky, and they can maybe move around or leak. So the dressings that we will come across would be like nice foam dressings. Silicone dressings are lovely on the skin, and then will be the likes of the Tubby Fast or the Tubby Nets. We'll be securing them, especially in areas like under the axilla or the arms. Again, if that's not accessible to you, you know, we have come across the likes of using just gauze squares, sanitary towels. They're not ideal, but they do absorb exudate to a point, but then do they stay? No, they don't. And then from that then, Suzanne, Kerry and I did do tabletop. Kerry wore dressings, you know, sticky dressings, non-sticky dressings in underarms. I wore the HidraWear, and yes, it stayed in place. My dressing stayed in place. It was very comfortable to wear. I showed it to a couple of other practitioners, and they were well impressed. Yeah, I didn't feel it cumbersome. I didn't feel that it was an extra piece of underwear on me. Yeah, I felt good in it. I felt that the band maybe across just over my bust was a bit not uncomfortable, but I knew it was there. But then after a while, it was fine. But no, the dressing stayed under my axilla, and I wore it for a week. I wore it for 6 days continuous, just to see. Now just to see what it felt like, more so than anything.
And how did you get on with any of the dressings, like the adhesive island dressings or non-adhesive dressings with tapes and things like that?
Yeah, look, you know, we put them on. First of all, we had to make sure we had shaved, and that was an issue because if I had an actual wound under there, would I have been able to shave? So yes, put on my adhesives, then tried to take them off, causing irritation. Then some of them were falling off because of sweating, causing that friction and shear, that chafing. So it was very, very time consuming, as opposed to then putting on my HidraWear dressing and my garment, and off I go. Timing was halved really in that. And also then in relation to how I felt and how I would go out my day.
Oh, that's lovely to hear. And what do you think are the main problems that you encounter when you're trying to dress an armpit or a groin or any kind of other, like a buttocks, any other areas that would typically
it's just that retention. It's just that retention, because if there's high exudate, if there is any issues of inflammation or maybe infection, there's going to be high levels of exudate, it's going to fall off. So that retention. Then sensitivity.
Yeah.
So we would try to use maybe silicone dressings, which are nicer on the skin, but then you're going to be using an adhesive to try and get it stick. But yes, that sensitivity to that adhesive. Again, you know, if there's lots of exudate and it's leaking, the dressing can fall off. So really, when I choose a dressing, I'm going to choose a dressing that's going to stay in place, and that's going to cause, you know, minimal trauma.
Yeah.
So I suppose in relation to that then, you know, every day is not the same. So it's all about what's achieving, what's going to work for you on that day. So that day-to-day self-care. And it's just to give you that empowerment and that ownership that, yes, you can choose the dressing for today. It mightn't be the right one for tomorrow, but it worked for today.
Is there a way to reduce the sensitivity to adhesive? Is there something that people can use before they put on a dressing to help with that rash?
Absolutely. So you're talking about that barrier cream or that barrier ointment or barrier spray. Again, if you use any of these barrier substances, they enclose the moisture on the skin. So they form a second layer of the skin. They nearly mimic the skin. So they will cause less trauma to the actual surrounding skin. There's lots of them on the market. I suppose we'd be familiar with the likes of Cavalon, Aldenex. Some of them are silicone based. Again, they're a barrier, so just be very, very aware of, they're not a typical moisturizer, they're a barrier. Then other over-the-counter barriers that we'd be familiar with is like Sudocrem, Vaseline. But again, it's to be mindful on how to use them. Minimal, leaving a light sheen. Again, the same with the Vaseline, a light sheen. Now, obviously, then you have to look at the dressing retention, because if you're using an adhesive dressings, you have to make sure that that adhesive is not going to be sitting on the Vaseline or the Sudocrem. But so it's just to be familiar with that there is over the counter, but just be aware of that retention afterwards.
That's great advice. So less is more if you're using a barrier cream. And does that go just around the wound or on the wound itself?
Around the surrounding skin, not on the wound. We don't tend to put any creams, ointments on wounds at all.
Okay, great. You mentioned their dressing retention. Can you just talk a bit about that? Like, what is dressing retention and why is it important?
So it's a matter of dressing. You choose a dressing that's going to stay in place and it's not going to cause any trauma on removal. So if you look at your dressings, the dressing you're choosing, obviously look at the manufacturer's leaflet in it. If you're not familiar with that dressing, take out the pamphlet, have a read of it. If it says it has to stay on for a minimum of 3 days and you're changing it once a day or twice a day, it's incorrect dressing. It's going to cause friction and shear on that surrounding skin. And then obviously the pain of it, if it's causing pain on removal, again, maybe it's the incorrect dressing. But again, if we go to choose a dressing and then try to remove it, we tend to pull it in the direction and pull the skin taut so that we don't cause a friction when we are removing it. So it's a matter of, and there is sprays you can put on dressings to try and remove them, or into the shower, soak them off. Yeah. Nothing wrong with that either.
Yeah. Great. So like with all of your knowledge now about HS and HS dressings and how it impacts on a person's life, do you want to talk a little bit about the impact that that daily or regular wound care can have on a person's life?
Well, as I said already, when we look at wound care, we're looking at a holistic point of view. So we're looking at the client themselves and what goes on in their daily lives. So when we looked at the research in relation to that, we saw, emotional health, anxiety, sexual health, daily routine, family life balance were huge issues. And then it was the wound. So really, if we felt that as clinicians, that if we could try and manage those issues as well as dressing the wound, choosing a dressing according to that, including you as the person with HS, formulating a good care plan, and that's where that diary will come into place again. So just, in relation to that, a good well-being approach. We're having problems as well in relation to types of dressings. We're cutting dressings as well, like you're cutting dressings. So, it's a matter of having a good, colleague-client balance. And we do have empathy and we do have such compassion for you that, the client that does have the HS,
So when you mentioned their like well-being and a holistic approach, Kerry, is there other things that we can do as people with HS to improve our wound outcome? Like, say, for example, diet. Like, does what we eat actually have an impact on our wounds?
Absolutely. Hi, Suzanne. Thanks so much for the invite. So as we know, anyone with a wound should eat a healthy, balanced diet. So we need your macro and micronutrients, carbohydrates, protein, vitamins, minerals, because any deficiencies in those can actually impede on your wound healing. So we would tend to follow the food pyramid. We need things like protein. What protein does, it builds and repairs your skin. It also helps fight infection. So really important, anyone with a wound. Eating more fiber. Fiber bulks up the diet. So helps you feel fuller and also helps to regulate insulin levels. We would say, as you can see at the top, reducing your refined sugars. And I do know from reading a bit about the HS that it can improve symptoms, regulating your insulin levels.
Mm-hmm.
So it can improve the symptoms of HS. So we would say eating healthily and getting regular exercise if you can. That will also help with your weight. If you're finding you're not exercising as much, you know, there is a chance that you may be getting some weight gain. So if that's the case and if that's the problem, then I would suggest speaking to a dietitian and even keeping a food diary.
Great. Anything else we
Absolutely.
should reduce from the diet?
Red meat. They do say we should be eating obviously more white meat and fish.
Mm-hmm.
I know in some cases with HS, actually dairy products can cause flare-ups. So they do say about an elimination diet. So if you're finding you're getting a flare-up, maybe eliminating certain foods from your diet, keeping a plan, keeping a diary, and seeing does that improve the symptoms. Now, it may take a while for the symptoms to improve. So obviously, you know, keeping a diary is good. What else? So plenty of fluids, because we do know the amount of exudate that you lose when you have HS. So, you know, you really should increase your fluid intake as well.
Okay. I'm going to ask you about smoking. I just want to shed a bit of light as to what smoking actually does to the body. Instead of just telling us to stop smoking, maybe explain a bit about how it impacts our wounds and what it does to the body and the benefits of stopping smoking.
We know that oxygen is essential for good wound care and for a wound's healing. So what it does is the carbon monoxide obviously reduces the oxygen, and it actually takes as long as 3 days for us to get rid of the carbon monoxide after we've had our last cigarette. I do understand it's very hard to quit, but there are, you know, there's help out there if you are looking at quitting. Just to know that after 72 hours, you'll definitely be feeling better. Your energy levels will increase. Your lung capacity increases by 30% after 2 to 3 months. So, and the chance of a heart attack would drop by 50% after a year of quitting smoking. So, you know, there are different resources, support groups, prescription medication. So if that's the route you want to go down, maybe discussing that with your doctor.
That's great. Okay, thanks so much. I know you have tried HidraWear, and Karen, you spoke a little bit about it earlier on, but I just would love to know, how do you think HidraWear would benefit people with HS, knowing what you know about HS wound care now?
We have more faith, I suppose, now, Suzanne, in relation to the HidraWear, because you yourself is living with this, and now this garment has come out from, you know, so it is, you have definitely more faith in relation to that. I suppose there's more a treatment choice appropriate to the clients now. They have this garment, they can put their dressing underneath it. As I said, I wore it, it stayed in place, I wore it for 6 days continuously. I felt in control of my day-to-day wound care. I didn't feel it was cumbersome. I didn't feel it was an extra piece of underwear. I felt it was underwear. I didn't feel it was a medical thing. I felt it was, you know, stylish, and it was not cumbersome. So yes, most definitely. Yeah, I felt very, very confident in wearing it.
That's great. Thanks so much. So we have some questions from the HS community. The first one is from Laura Ann. What is the best method of care at home to avoid infection?
Okay, so as Karen said before, hand hygiene is the most effective way to reduce infection in a wound. So hand hygiene, wearing your gloves, keeping a clean area where you're going to do your dressings, obviously disposing of your dressings properly. There's also guidance out there on self-care for wounds, and actually myself and Karen have just been working on a leaflet which we're more than happy to share with you, that can be given out. YouTube is a great way as well, so just to make sure that your dressing technique is correct. So they would be some of the things.
What about salt baths? Are they any good?
Well, absolutely, they have been, and if that's what your dermatologist or doctor prescribes, then absolutely, I know that they're soothing. Bleach baths is another one. Now, when you actually read a bottle of Milton, it does say that it's not, you're not supposed to bathe in it, but dermatologists will actually state, and on their guidelines, they do state that they do help, but I would always say under the advice of your consultant or your GP.
Okay, so our next question is from Shannon. She'd like to know about wound care in intimate areas because they're particularly challenging wounds to care for.
Absolutely. And as Karen said before, a lot of it would be down to cutting your dressings to shape, different shapes like elbow shape, heel shape. They could be actually good and recommended for underarms, etc. If you need to hold them in place wearing cotton shorts, for example, to stop that friction and shear. Again, you've got your HidraWear to hold the dressings in place under your armpit area. If you are wearing shorts, then we would tend to say to turn them inside out to stop the seams from causing friction and causing any trauma.
That's great. And so, the next question is from Julia, and I think it's quite similar. It's I'd like ideas on dressing wounds in the groin and intimate areas. She's allergic to elastoplast, which is an adhesive, and most dressings. So I think what you said about the shorts is great, and cutting dressings. We're also developing a pair of shorts at the moment that will dress the groin. But is there any additional tips on just dressing the groin?
Well, as Karen said before, if you are allergic, then maybe all silicone dressings are the way to go. They can work out quite expensive. So if you need to hold the dressing in place, actually tapes are made in silicone as well. And that has very low sensitivity rates. What else? Using natural materials. So wearing your cottons. Good skincare, again, is, definitely high on the agenda.
Great. So question from Pasha. How to control itching when it goes from the pus stage to the thin weepy discharge stage? That's when it seems to itch the most.
If the itching is due to a lot of moisture, then it might be that you need to use a more absorbent pad at night around the area, especially if it's in the groin area, under your arms, etc. Again, we can't speak enough about the CPR of good wound care. So cleanse, protect, restore. So that's where we would use our barrier creams, as Karen spoke about before, and emollients, which emollients are moisturizers. So they could help with the itching. Something with an anti-itch in it. There's lots of gels and creams out there now that have anti-itching. Taking an antihistamine at night, obviously, if you're okay to do that, unless you're on other medication. Bath additives as well. So such as oilatum, lotions, etc. Keep a couple of ice packs in the freezer and wrap it in a towel, because obviously you don't want to burn the skin, and absolutely place that on, and that should cool down the area.
Great. So our last question is from Denise, and she wants to talk about the use of antibacterial, antiseptic, and antibiotic products. And I think this means topically. So what's your opinion on topical use of antiseptics, antibiotics, and antibacterial agents?
Any antimicrobial needs to be used in a structured and planned manner. Okay, so really 2 weeks should be long enough for it to be effective. Okay, if the infection is gone in that 2 weeks, that's great. You can stop using your antimicrobial. If it hasn't, then I would suggest then trying a different one. As we know, there's so many different ones on the market.
I would add in there as well that sometimes it's prescribed by your doctor, and I would I agree with you about them being overused, and I'm guilty of this myself, of lashing on some creams. So I suppose it's just structure is a really good point, to use it in a structured way and as prescribed or as recommended by your doctor.
Suzanne, you're just saying there about lashing on the creams.
Yeah.
If you put the creams on, absolutely, if you put them on too lavishly, they prevent the skin from breathing. Okay,
Yes.
so they clog the skin, and that's going to cause even more problems. They're also going to affect the absorbency of the dressing that you're using.
Yeah.
So as Karen said before, light sheen. Whatever cream you're using, just to leave a light sheen, let that skin still breathe.
That's great. Okay, well, thanks so
Okay.
much, ladies. I think we've covered a lot of ground. I hope everyone watching found this useful. Is there any final words that you have before we sign off?
Just thank you so much for inviting us. You know, myself and Karen, just speaking for Karen as well, have learned so much, actually, so much extra just from all the documents we've read. And, you know, we do realise it is such a struggle.
Yeah.
And we do realise that you may have HS for a long, long time before it's actually diagnosed. But there is help out there.
Thanks so much.
Thanks,
Thanks so much, everyone. I will share this with all our HS community, and hopefully it is a help. So thanks so much, and goodbye. And
Thank
thanks
you.
for watching, everyone. Take care. Bye-bye.
Thank you.
Bye.